As a med student, you can't just be like, nope, nope, I'm not doing this.
We're only 3 hours into rounds. I haven't even started my 45-minute tangent on a completely unrelated topic.
I did that one time and was the most embarrassed I've probably ever been in medicine. It's bad. And it's probably like the 100th hour that resident has been working that week. Hey guys, welcome back. I'm Jess the MD. Thank you so much for joining me. Let's watch some crazy medical TikToks and react to them.
Thank you for coming to the faculty meeting. The new interns start next week, so I need everybody to be nice. What are you looking at me for? Dude, you know exactly why he's looking at you.
I think that's surgery.
Whatever emergency. Yeah. Interns are more scared of you than me. Surgery, you personally are responsible for a 300% increase in burnout over the last 5 years.
Surgery is a super tough rotation. It is a super tough residency in general. So I totally get this, yeah.
Come on, I'm not that bad. Bad enough they published it in the New England Journal. Hey, Psych, why don't you go read the DSM and let the doctors speak? Sure, you know they have your picture in there, right? Surgical personality disorder. Okay. You know what? That's enough. Surgery, just be nice. Neurosurgery is the one you should be talking to. Yeah, and we forced the neurosurgeon to take a 2-week vacation out of an abundance of caution. You know, everyone's ganging up on me, but I think I'm the nicest one here. You're really going to say that when pediatrics is sitting right over there?
Peds. Okay, pediatrics, they are the nicest, for sure. I will say though, the actual residency is tough. It is a tough program. I rotated through pediatrics in residency and they are all some tough cookies over there.
We have one of our residents kicking off orientation this year, Dr. Bill. You guys know him? What? Is there a problem?
Residency is tough and there are always those memes every year. July 1, interns start, do not go to the hospital. And I will tell you that as an intern, you are very, very closely monitored by your upper level residents. So it is unlikely that you're gonna have a huge screw up as an intern. Through residency, you're overseen by an upper level resident or an attending to the extent that you need. And so your superiors are watching and making sure that you're doing everything correctly and safely for the patients. And they're constantly assessing to what degree you can handle things by yourself. Over time, you can handle more and more and more by yourself until you are finally ready to graduate from residency and become an attending physician and handle things all on your own. Of course, everyone needs help sometimes and it's always okay to ask questions. We all need to look things up or ask some questions. But once you're an attending, you're kind of on your own and you make the decisions for your patients with your patients, of course.
Knock, knock. Hi, I'm the new med student.
Knock, knock. Hi. Oh,
welcome to hell.
Oh, no.
No. I'm going back to palliative care.
Okay, palliative care, they are extremely nice over there, and cardiothoracic surgery is probably the polar opposite in terms of how tough they are, and especially how tough they are on the trainees. Surgery is high risk, high intensity. It just is, it always is. But I'll tell you, as a med student, you can't just be like, nope, nope, I'm not doing this. If you're on a rotation, you are doing it. You're doing it, and it is what it is. There's a lot that you do through med school, through residency, that may not be your favorite thing to do, but you're gonna do it because you have to experience it and learn it before you can go out and be an autonomously practicing doctor.
Knock, knock. Hi, I'm the new med student. Oh, well, we're just starting rounds and we have a patient with congestive heart failure. What would you like to do?
Jeff, bread and butter.
Start Lasix? Whoa, tap the brakes there, Dr. House. What's the rush? I'm sorry? I mean, we haven't even painstakingly discussed the pros and cons of every possible treatment option yet. Oh, okay.
Internal medicine rounds and family medicine rounds definitely last a long time because you go through all of the possibilities, and rounds are used not only to help treat the patient, but also help the residents and the med students learn all of the medical stuff that they need to know. So rounds are kind of twofold, and that's why everyone goes all together with the attendings and the residents and the med students and everyone. It's the way we learn in medicine, especially hospital medicine.
We can't just make routine clinical decisions without an exhaustive literature review first. I mean, look at our resident Thomas over there. He's already elbow deep in PubMed searches. How do you have time for all this? We're only 3 hours into rounds. I haven't even started my 45-minute tangent on a completely unrelated topic. I thought rounds just started. Yeah, exactly. You guys hear that? No, what? It's a tuning fork.
Oh,
there's a neurologist close by.
Rounds almost always take forever, and sometimes it's very much attending dependent. Sometimes it's team dependent. If you have patients on your service that you've had forever that you're making very small intricate changes for, that's one thing. If you have a new patient that has a big medical problem, that's why they're in the hospital, and there's a lot to manage, yeah, rounds can take a really long time.
There he is. Thomas, curbside, now. Sir, wait, we want you to accept liability by giving us medical advice on a patient you've never seen before.
They asked for a curbside. Okay, so curbsiding is asking for advice on a specific patient without actually having that specialist see the patient and put in a full official note. The specialist that you're curbsiding doesn't officially accept liability for the patient because they didn't see the patient. They don't know the patient. And so you're still accepting liability. You're just asking for advice on a specific question that you may have when you're curbsiding someone.
Good morning, everybody. Good
OR.
morning, doctor. Oh, looks like we got some new instruments to work with here. Oh, we sure do, but don't get too close now. Everything's sterile. Oh, you know me. I'll be careful.
Oh, no.
What do you call this instrument?
Oh, he's touching
that's
all
a
of
curved
the
flinging
sterile
looper.
instruments.
You're going to like that one.
Ooh, I've always wanted to try one of those. Well, we got some interesting cases. Should be a pretty good day.
Hi, I'm the new med student. Don't move. Did you touch anything? What? No, I just walked in. Shuffle your way toward a corner. Keep your back against the wall at all times.
And he still probably contaminated something.
No, don't move.
So that was probably the surgical tech, and they are very, very specific about med students and even interns, residents not touching things because yeah, it's all sterile. And I remember being a med student and being like, I don't want to touch anything. Like if you tell me to touch something, I will double check and ask multiple times because if you contaminate the sterile field, oh, it's a whole big thing. You got to get a whole new set of instruments. I did that one time and was the most embarrassed I've probably ever been in medicine. It's bad. Patient sleeping peacefully at 5 a.m. Oh, yeah. Med students, interns, pre-rounding, waking them up. Oh, it's the worst. No one wants to be woken up at 5 a.m. by an intern or a med student pre-rounding, but it happens every day in the hospital and it's awful. This is, again, why we send people home from the hospital as quickly as we can because you do not get the rest and the relaxation and the healing and the recuperation that you need in the hospital. We're treating you for your acute medical issue and your healing time is at home. It's gonna be at home. Well, that's everything I know about hypomagnesemia. Oh God, the lecture. It's getting late. Does anybody have any questions before we all go home? It's probably Friday too. Questions at all? Are you sure? Last year. Oh no, is that the med student? Don't ask any questions. Please don't ask Oh gosh, they're going and it's probably like the 100th hour that that resident has been working that week. Even though I think officially the rules are no more than 80-hour weeks on average, they average it out over 4 weeks, if I remember correctly from when I was in residency. And that resident just wants to go home. They've spent a lot of time in the hospital and they just want to go home. On that note, thank you so much for joining me. I'm Jess the MD. I really enjoyed spending time with you. I hope you enjoyed spending time with me. Consider liking down below, subscribing to the channel, stick around, and I will see you in the very next one.